And joining us now is physician and MD Dr. Eldred Taylor out of Atlanta, Georgia. He is the author of Are Your Hormones Making You Sick? And the Stress Connection. He is the co-founder and president of the American Functional Medicine Association. And I am so excited to welcome him to the program. And Dr. Taylor, you have been a board-certified holistic physician for a lot of years now and in practice for a few decades. And your degrees are from Vanderbilt University in Nashville and Emory School of Medicine. And you've been highly decorated. What got you into the world of CBD? And do share with us, please, Dr. Taylor.
Yeah, well, thanks so much for having me. Well, my original training was in obstetrics and gynecology, and I practiced like every other OBGYN practiced. I gave people birth control pills, gave them hormones, did pap smears, until my wife began having what were hormone problems, and I was doing for her what I was doing for patients, and because I was living with her 24/7, I saw that it wasn't working very well. So I actually had a patient who came in and told me about bioidentical hormones and progesterone, and I started to research it and found out that what I learned in my residency at Emory really didn't teach me a lot about hormones and how to really take care of people and get them to function in a normal manner. So that started my road down. I don't like to call it alternative medicine. I like to call it functional medicine. How do we get people to function normally by helping the body do what it naturally should do? So that got me started down that road. And then I began to get interested in other things, how stress affects the body, how the gut affects the body. And a lot of the things that I do come from patients, just like with hormones. So I started to have patients ask me about CBD and cannabis for cancer, and I started to do the research and saw that, hey, why aren't I doing this? And so I've probably been using CBD oil in my practice for the last 3 or 4 years, primarily for anxiety, for sleep, and for pain. And in Georgia, you can have a cannabis card, but it's only for certain diseases. It's epilepsy, Parkinson's, end-stage cancer. And so I have a few cancer patients who I've registered them for a card and to help them with their nausea and things like that. So, yeah, so it's kind of a long, winding road, but the great thing about functional medicine, it's always something new out there that you can learn, and you can really help patients where conventional medicine may not be able to really help.
Doctor, absolutely, because it's how we function in the world. And right now we are a world of very stressed out people. We have a volatile stock market. We don't know what's going on because of the coronavirus. And the coronavirus has interrupted so many schedules and so many people and their ability to travel, and trips got canceled, and people stuck on cruise ships, and not enough testing kits. And I mean, we could go on and on and on.
Right.
Not enough Purell in the world. And so, how is this crisis, how does it correlate to how we function in a crisis situation, and how can CBD possibly help us?
Well, as you said, I wrote 2 books. One is The Hormone Connection. One is Are Your Hormones Making You Sick? And the other one is The Stress Connection. And that Stress Connection book evolved from several years of dealing with female hormones and finding out that when stress is involved, my treatments didn't work as well. And from that, the stress affects every system in the body, and it especially affects their immune system. So I just put out a newsletter for my patients and say the number one thing that you should do to prevent you from catching the coronavirus is don't panic. because stress is going to weaken the immune system. So you're right. Our society makes us susceptible to viruses like that because it suppresses the immune system. But, I would want to, I've also done, talked about this with my patients, is that there's information now that in Shanghai and in Wuhan, China, that they are treating the virus with intravenous vitamin C.
Intravenous vitamin C. I know.
Yeah.
Yeah, I've been interviewing Dr. Andy Saul because he's very much the orthomolecular guru.
Yeah.
He's very much involved in this, Dr. Taylor. So, it's very exciting to see. Basic vitamin C comes to the rescue once again, and I've upped my vitamin C as well. I have, and along with the hand washing. I want to get back to the CBD for just a moment because I know you're concerned about the amount, and we just had this wonderful Doc Potter on who wrote a book about cannabis for seniors talking about the opioid epidemic, but you really are involved in it as a physician day to day, and tell us about how this could really be such a wonderful resource and an answer.
Right. Yeah, because CBD primarily, it calms down the nervous system and neuroinflammation, and it also helps with regulating neurotransmitters. And with opioids, that's what's happening. A lot of times it's for pain relief, and the receptors become less and less sensitive the more and more they're bombarded with the opioids. So the CBD seems to help to regulate those neurotransmitters, helps to reset those receptors, and to be able to alleviate the pain and also the anxiety from the pain. A lot of times people, they're so anxious about the pain and getting relief from the pain that just adds to it. So CBD is just a calming factor for the entire nervous system. And so you get a lot of the benefits from that people were initially receiving from the opioids. But as I was saying, is that the more you're exposed to them, the less and less results you get from the opioids, and then you have to go to more significant drugs like heroin, and that's usually what people are dying from, is from having to go to another drug because the opioids aren't doing what they were doing originally. So the CBD can relieve the pain, can calm down the nervous system, calm the inflammation, and relieve some of the withdrawal symptoms that they get from not having the opioids.
Let me ask you a political question. I don't mean in the politics of the presidential election. I'm talking about the politics of functional medicine doctors. And has there been a movement to really understand and embrace the cannabinoid family?
I think it is becoming more and more acceptable. You're seeing this more in some of the continuing medical education, because there's no doubt about it, the endocannabinoid system, I mean, there is a system in the body that is sitting there waiting for cannabinoids. It's a part of the nervous system. And I think, you have to present this in a scientific, physiologic manner, and you wouldn't have this system if the body didn't need it to help regulate it. And so that was the eye-opening moment for me, because I tell you don't learn about the endocannabinoid system in physiology.
No. 30
years ago.
Yes.
Yeah, 30 years ago when I went to medical school. So to find out that there is a system of receptors that are, waiting for cannabinoids in order for it to regulate the nervous system, really it makes it kind of undeniable that that's something that the body needs, and we should really try our best to understand how to regulate that system in a positive manner.
So this is a fascinating conversation, Dr. Taylor. We want to have you back. Give us the best website, how people can find your books and all the work you're doing in the world of functional medicine.
Well, my practice is taylormedicalgroup.net, www.taylormedicalgroup.net. We also have the American Functional Medicine Association, with is www.afmassociation.com. There's information there. And then I also have a supplement company. It's Taylor MD Formulations.
Awesome. Thank you so much, Doctor, and we'll be back in just a moment. This is Frankie Boyer.